can't believe it's been 20 years. I think back to when this project was first developed and talked about, and for me, I just really happened to be in the right place at the right time. And I know that's not something that you would typically say, but certainly when my son was receiving his care here, that long ago, we were a part of the process, and I do say that I was truly at the right place at the right time. And I am so grateful that our hospital leadership at the time really started believing in and owning patient and family centered care, and that's really how I got involved.
And I can remember having conversations with Dr. Parrish about it, and Dr. Pruitt and Dr. Mansberger, and I know when I came back here in '82 from Children's in Philadelphia, I mean, everybody that I ran into wanted the Children's Hospital. That's where most of us trained in a Children's Hospital, so we wanted the same thing here.
A lot of times in an adult hospital, you'll have a service that takes care of their patients and a service that takes care of their patients, and they don't mix very well. But one of the nice things about a children's hospital is that you really do focus on the care for the kid.
For example, a room, an adult physician may say you need a small room because you got a small baby. But in fact, you got a family, and so you need bigger rooms and more space. And so that concept took a while to kind of develop, but that the children and the families helped us.
We're trying to keep patients and families together as much as possible. And 20 years ago, that's not how it was here. I can remember sitting out in the waiting room more than I was at Daniel's bedside, because the physicians were making rounds, because nurse changes shifts were happening. And that's the time when I really did need to be at Daniel's bedside so that I could be a part of that conversation. And I'm so proud that this is what we do today. This is carried through, and that's the important piece of patient and family centered care.
But they also appreciated that everything here was designed to improve the health and care for their child and for their family. And they knew that everybody that they worked with was here because they were here to take care of children and to serve the children. So I think what sets us apart as a children's hospital, which sometimes gets lost, is it's not just the doctors and our specific training in pediatrics, but every person here is committed and has had specialty training in caring for kids.
And we're excited about our future. We've got our 20 years now behind us, and we're looking at the next 20 years. We're doing a lot of strategic planning. We are putting pediatricians and specialists out into the community. We're excited about our future Columbia County Hospital because we'll be able to see pediatrics there. We'll have dedicated pediatricians in the emergency room. We'll have observation beds for our pediatric patients. So we will be really spreading this expertise out so that it's more accessible to families and children beyond these campus walls.
We are the state's only state-supported medical school. We are the state's children's hospital, and we are the training ground for pediatricians that are all across the state of Georgia. Most pediatricians across the state of Georgia either went to medical school here or they came here to do their pediatric training.
I do believe that at the time the Children's Medical Center, now CHOG, was built on the foundation for patient and family centered care. And while there have been so many leadership changes, name changes, personnel changes, the one thing that has remained true to our organization here is patient and family centered care. And this is something that you just don't check the box and say, okay, we're done. This is continuous. And again, I think it is the foundation of our existence.